Did you know that hip pain can be caused by an imbalance of your bite? A perfect example was a recent female patient who was referred to my practice because she suffered right hip pain, stabbing pain in her right buttocks, and pain down the right side of her leg and in her groin area for 4 months despite regular chiropractic adjustments. These symptoms are indicative of what they call sacroiliac weakness. Interestingly, 6 months before the pain episode started, she began replacement of her mercury fillings. Unfortunately, the patient's dentist was not aware of the interconnection between the occlusion or bite and the balance of the cranial bones and alignment of the pelvis. Evaluation uncovered that the patient had major cranial distortions, hyperocclusion on the upper right first molar, severe spasm of her right external pterygoid muscle, and subluxations of her right hip and pubic symphysis. Treatment involved a comprehensive cranial adjustment to correct the subluxations of her right hip and pubic symphysis, and an occlusal adjustment or bite adjustment to stabilize her cranium and sacroiliac joint. Treatment time was approximately 1.5 hours. Immediately following treatment, all the patient's symptoms totally disappeared, and she stated that she felt more balanced. The dental whole body connection is a concept that very few dentists and even chiropractors have any knowledge or practical experience with. The entire body works like a slinky. Practitioners must have an extensive knowledge to understand the reciprocal interrelationships of the muscles, ligaments, and bony interlinks. Unfortunately, very few practitioners on this planet possess this expertise, and patients do not get resolution despite visiting numerous doctors, dentists, chiropractors, and other healthcare practitioners. For more insight into how the body really works, go to icnr.com and review some of the 200 case studies and numerous articles.